This is One on One. We are honored to be joined by Natasha Coleman, Senior Director of State Health and Primary Care Systems, American Cancer Society. That's the Northeast region. Good to see you, Natasha.
Good seeing you too, Steve.
How are we doing when it comes to the fight against cancer?
You know, we made some great strides when it comes to cancer because of our research dollars and the funding. The American Cancer Society is the largest nonprofit of funders for researchers. But when it comes to screening and getting our residents here in New Jersey screened and preventing cancer, we could always do better.
So, listen, anyone dealing with cancer, it's real and your family's dealing with it. And we wish you nothing but the best in your recovery. But people are often saying, Steve, make sure you ask which is the most prevalent, A, cancer, and B, the most dangerous. First of all, is that I hate to say a good question. Is that a good question to ask?
No, it's a good question.
I know why people ask it.
But what we say is, listen, 2/3 of all cancers can be prevented.
Say that again?
2/3 of all cancers can be prevented because of our healthy behaviors and behavior changes. So keeping a healthy lifestyle, elimination of all tobacco use, getting screened for your screenings, your checkups, talking to your health provider about screenings will really get you in the roles of preventing cancer, of reducing your risk of getting cancer.
And that's a lot what's going on. By the way, the 24-hour hotline is going to be up. You'll see the 24-hour hotline right there. So talk to us about a few initiatives. The Making Strides Against Breast Cancer. What is that initiative?
So that's our 5K walk. It's our national initiative to raise awareness around breast cancer. And it's really an opportunity for us to let breast cancer patients, caregivers, and the family members know they do not walk alone. So it's a 5K walk. We have them all across the country. Here in New Jersey, we have 8 Making Strides Against Breast Cancer walks. And we bring thousands and thousands of supporters to walk every Sunday. Yep.
Whoa.
Yep, in October. October is National Breast Cancer Awareness Month, and that's when you'll see the world turn pink, and we really say that that's an opportunity for us to let breast cancer patients know and their family members know they're not walking alone.
Relay for Life.
Yeah. Relay for Life is our signature event. It's our signature fundraising event. It's for all cancers. And what we say is, cancer never sleeps. So some events are overnight, some are 12 hours, some are 6 hours, but it's an opportunity for us to say that we are fighting back to cancer. We are making this an issue. For the American Cancer Society, our mission is saving lives, celebrating lives, and really leading that fight.
I'm curious about this. One more, a couple quickies here.
Yeah.
I keep reading about Hope Lodge.
Yes. So Hope Lodge is our lodging opportunity. It's our lodging services. It's a free lodging service for patients and their family members to stay when they're seeking treatment outside of another city.
Why is that so important?
It is important because when they're seeking treatment in major cities like Boston, New York City, Philadelphia, and most of these treatment services are weeks, sometimes months.
Right.
So to find lodging that is free,
It's free.
It's free.
How does that happen?
It's free. So these are opportunities. These are services that the American Cancer Society funds, and because of our research dollars, because of our fundraising opportunities, we're able to provide Hope Lodge services. So it's a home away from home is what we say.
The other piece of this that I keep reading about is transportation.
Yeah.
I'm like, what does transportation have to do with this whole fight against cancer?
Yeah. When we speak to our healthcare providers, we understand that it's access. And one of the barriers to getting patients to and from treatment is transportation. So for either chemotherapy or radiation. So we have a volunteer-driven program. It's called Road to Recovery.
Road to Recovery.
Road to Recovery. And we have volunteer drivers who volunteer their time and their vehicle to get patients to and from treatment.
The other thing I'm curious about when it comes to the discussion about cancer, by the way, let's put up the 24-hour hotline again, is, first of all, everyone's been touched in one way or another. I know it sounds like a cliche, but it's true. The other thing is the psychological and emotional issues connected with just the word cancer. And for me and others who have, you go for a test, and the anxiety about it, and for those who've had to face a prognosis, a test result that it can be shocking. What kind of progress, I have a question here, I promise, Natasha. What kind of progress have we made, if at all, in the way we are hearing the word cancer and responding to it?
Yeah. I think the diagnosis with cancer, it's not a standalone issue. It becomes a full, comprehensive cancer program, cancer care. And so the patient is not alone. So it's not just the oncologist, it's a full cancer team. So we know it's overwhelming, and the opportunity really is to engage the entire family. So it's not just the patient, it's their caregiver, it's their family members. So they're all part of that journey when it comes to their cancer diagnosis.
The American Cancer Society does, in fact, offer those emotional supports?
We do. Yep, so we do. So we have a 24/7 hotline, 1-800-227-2345. So we offer those emotional support through our cancer information specialists on the phone, any time of the day, any time of the week. But we also partner with our healthcare system partners. So we have some navigators that are in the hospital. We work with our social workers and oncology to really make sure that the patients feel like they are not walking in this fight or this journey alone.
Language matter here?
No, of course not.
No.
Yeah.
In terms of someone's ability to speak English, how do you deal with that?
So we have our cancer information specialists on the phone that are bilingual, who speak multiple languages. So if anyone wants to call the American Cancer Society, they can reach and speak to a specialist in their language, or we connect them with a language line. But I think at the hospitals and our healthcare system partners, there are available resources to them when language is a barrier.
Before I let you go, we did hear about you again through our friends at Horizon,
Yes.
major underwriter of public broadcasting, of what we do, and as
Yeah.
well as NJTV News. What's the connection with them?
Yeah, so Horizon Blue Cross Blue Shield of New Jersey have been a long-time partner with
Is
the
it the
American
foundation?
Cancer Society. It's the entire organization, but includes the foundation as well too. For over 20 years, we've been a partner. A few years ago, they came to us and they said they wanted to choose the American Cancer Society as their priority organization, elevate the partnership that we have, and making sure that both their members and their employees understand the importance of cancer screening and cancer awareness.
Natasha Coleman.
Thank you.
Is Senior Director of State Health and Primary Care Systems, the American Cancer Society of the Northeast region, which covers?
Maine to Maryland.
I want to thank you for what you're doing
Thank
every
you.
day. And by the way,
Thank you.
that's why we made sure that hotline was up. Hopefully you use it to get more valuable information. Thank you, Natasha.
Thank you.
This is One on One. We're coming to you from the NJTV Agnes Vera studio. We'll be right back after this.
One on One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One on One with Steve Adubato has been provided by the Russell Berry Foundation, Horizon Blue Cross Blue Shield of New Jersey, TD Bank, RWJ Barnabas Health, PSC&G, the Healthcare Foundation of New Jersey, and by Caldwell University. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.